retinal detachments happen in about 1 in 10,000 persons per year. So if I'm looking after a population of 500,000, I will see roughly 50 retinal detachments in that 1 year. Hi again, my name is Hadi Zambarakji. You may have seen some of my other videos. I'm a retina specialist and a cataract surgeon as well. So I'm going to talk to you today about, or in this video, about retinal detachments. What's a retinal detachment? First of all, what is the retina? The retina is the light-sensitive layer that lines the back of the eye. So it's on the inside of the eye, a bit like wallpaper. It just lines the inside of the eye. Well, it lines almost 2/3 of the back of the eye. So light falls onto the retina, is converted into a signal which goes back to the brain through the optic nerve and the visual pathways and the visual cortex. So the back of the head, the back of the brain is what analyzes this information and translates it into images. So a retinal detachment is when the retina peels off the back of the eye. This is obviously a very serious condition because it means vision becomes affected and potentially vision can be very severely affected. So to start off with, how do patients with retinal detachments present? They present usually with flashing lights, floaters, and sometimes they even present with a visual field defect. That means a shadow in their vision. So does everybody get these symptoms? No. Some patients simply present with a few little floaters and then they get a detached retina. In general, patients will have symptoms, but sometimes these symptoms may go unnoticed, and that's why the patients may not necessarily present early enough. The key thing for patients is to present early enough, to present at the point in time when it is possible to fix that detachment before the vision is affected. That's absolutely key. So who is at risk of retinal detachment? In general, the retinal detachments happen in about 1 in 10,000 persons per year. So if I'm looking after a population of 500,000, I will see roughly 50 retinal detachments in that 1 year, 50 fresh retinal detachments in that 1 year. People who are more at risk of retinal detachments are those that are very short-sighted, those that have some hereditary conditions that might make them more at risk of retinal detachment, patients that have a family history of retinal detachment, trauma certainly increases the risk of retinal detachment. So this is broadly speaking the important categories to think about in terms of risk of retinal detachment. The next question really is what can we do? So first of all, why does the retina detaches? The retina detaches because the vitreous, which fills the inside of the eye, separates away from the retina, and by this, it pulls on the retina and therefore causes a tear in the retina. It tears the retina. Once the tear has formed, then fluid can leak behind that tear and lift the retina up. And a bit like if you have a tear in your wallpaper and water comes through that tear, then it's going to go behind that wallpaper and lift it off the wall. So to fix the retinal detachment, you have to close the retinal tear. And the way we do this is either by going inside the eye using little keyholes. This procedure is called the vitrectomy. And we remove the vitreous, which fills the inside of the eye, and we then apply laser or cryopexy to the retinal break, which is the main cause of the detachment, and then we fill the eye with gas. The reason for filling the eye with gas is that the gas will hold the retina back in its position, in the normal position, so to speak, until the laser or the cryopexy takes effect, and in theory, that should be all that you need to do. Now, the success rate of such a procedure is roughly about 85%, 90% with one procedure. That means 9 out of 10 will have a successful procedure, but 1 out of 10 will need more than one procedure. There are other ways of fixing retinal detachments. That includes putting a buckle or applying cryotherapy and buckle to the eye. The buckle is a piece of hard plastic or silicone which is applied to the outside wall of the eye, and this also can help reattach to the retina. At the same time, with the buckle surgery, we apply cryopexy, which is like freezing therapy to the retinal break from the outside of the eye to reattach the retina. To avoid too much detail here, some detachments are suitable for vitrectomy, others are suitable for cryobuckle. Some can be done either way, and the decision to do one or the other procedure is to some extent surgeon dependent, but to a large extent also what kind of detachment the patient has, because Some are more suitable for buccal surgery, others are more suitable for vitrectomy surgery. It's worth mentioning a third procedure, which is actually a very good procedure because it does not involve major surgery like vitrectomy or buccal surgery. It's called a pneumatic retinopathy, whereby we can put gas inside the eye without removing the vitreous, and we apply laser or cryopexy from the outside of the eye. It's much less invasive. It works, and it has a pretty good success rate, although possibly not as high as vitrectomy and buccal surgery. But it is not a big procedure, and therefore it is very reasonable to use this sort of procedure in some eyes where the break in the retina is at the top. And I say this because this procedure does not work if the break is at the bottom of the eye. I hope I've made the retinal detachments relatively simple and the treatments relatively understandable. Please do get back to me if you want to ask me more questions.